going to be talking about the Medicare for All movement, the fight for healthcare justice in the United States and across the world, and the strategies that we need to learn and employ in order to get there. There's a lot of context in which we're having this conversation, and unfortunately, I think we should start with a little bit of context about maybe some of the recent setbacks, of which there have been a good number lately. In terms of national Medicare for all, this issue became incredibly prominent under the two presidential runs of Bernie Sanders, but he ultimately was defeated against somebody who specifically ran against Medicare for all, and that is currently who sits in the White House. On top of that, we've seen statewide campaigns like CalCare and Campaign for New York Health, unfortunately not make it over the finish line this year. And the latest to add to that is Whole Washington's own signature gathering campaign, I-1362 for statewide universal health care in Washington, has made the decision to suspend its signature gathering campaign, at least for the time being, on account of the rise of COVID and the frankly, very difficult to overcome challenges that was creating for our organization and our ability to gather signatures safely and out in the community in person. So with that, I want to start from there and ask everybody in this moment, sort of how are you doing? How do we feel about sort of the current state of the Medicare for All movement? And I guess I would love to just start with Jason on this end.
First of all, Jason Call. I'm candidate for Congress in Washington's 2nd District. I'm also a board member of Whole Washington. We're in troubling times. All of the statistics that we have known, and I kind of want to go back to Michael Moore's film Sicko in 2007, where he really identified how critical, how dire the situation was with healthcare in this country, with medical bankruptcies, with people having to choose between medications and food, and electing to have minimal surgeries where they needed maximal surgeries simply because they couldn't afford it. So the healthcare situation in the United States has not improved since that movie came out. In fact, it's gotten worse. And I'll just say, as a board member of Whole Washington, we were all very disappointed to have to suspend our efforts. We did it for public health reasons. But we really have to have a coming together with healthcare activists all over the country to figure out how we're going to fight harder to make sure that everybody is covered for all the treatments that they need, and to get the profit out of the system. I don't know what the answers are. But what I do know is we have to work together better than we have been, and that's one of the challenges that we are facing moving forward.
Agreed.
Does anyone else have any experiences that they can share of moments where they wanted to work together or needed support that they didn't get, kind of within the movement? Because I want us to talk openly about our needs as activists in order, what kind of support do we wish that we had? And then see if maybe that provides something of an answer for. So where do we go? What do we build in order to provide that support so that we can improve our efforts and win? Anyone?
I think support is something...
We'd like to, introductions first.
Oh, sorry. Sharice Nuggs, one of the co-founders from March for Medicare for All. As activists and organizers, that's something we go through every day. How do we get more support in our efforts? It's a constant battle to always try to persuade others to lean on the side that we're trying to platform. So we are platforming Medicare for All. We're trying to get healthcare justice for every person in America. Whether it's gathering signatures, whether it's doing a protest or a rally or a demonstration, we're always constantly fighting what strategy is best, and then sometimes that always doesn't work out. But that's something we always, getting that support for whatever issue that we're trying to fight or what strategy we want. It's always an uphill battle. So that's something that, as an activist, we'll never in my mind, we'll never get over that. That's something we always have. That's a hurdle. That's part of the job. Part of the job is trying to navigate those challenges.
Right.
You know, I first realized how bad the for-profit motive was for the delivery of health care 30 years ago when I was serving as the state health officer for the state of Nevada. My name is Joseph Jarvis, and I'm a public health physician. The state of Nevada, next door to the state where I received my medical and public health training, which is Utah, at that time, 30 years ago, had the most expensive health care on a per hospital, per bed day basis than any state in the United States, and therefore the most expensive health care in the world. But what was remarkable to me is, having trained next door in Utah, there was nothing like the high-tech services available in Utah, where the first artificial heart had just been transplanted. In Nevada, there wasn't open heart surgery. There were very poor newborn intensive care units. There was hardly any open heart surgery at all. There was no trauma center. It could go on. So why was it that the healthcare in that technology quality poor state was so much more expensive than next door in Utah, and literally 2 times as much? And as I looked hard at that, what I realized was the reason is the for-profit motive. It delivers poor quality care, which costs more. That is the underlying problem. And I began trying to blow the whistle, I guess is one way to put it, or try to draw attention to this fact, and got ostracized. I looked for colleagues and eventually stumbled into the Physicians for a National Health Program group, which I was very grateful to meet, and they helped me articulate a lot of those basic principles. But I, not too long thereafter, several years after, I should say, returned to Utah and became sort of a voice in the wilderness in a state that is well known for being on the very conservative end, wrong word, very Republican end of the country, and struggled to try to find a way of articulating what everybody really experiences, poor health care. Everybody has a family story of denial of benefits. Everybody has a family story of something going wrong in the hospital. Everybody knows people who can't afford the medications and therefore are suffering. This is the universal experience of Americans when it comes to health care. What has been so gratifying to me in the last few months, meeting you all, is I find people who have initiative and energy and a desire to do something, to act instead of just talk about it. In my culture, the LDS or Mormon culture, there's a phrase referred to as be anxiously engaged in a good cause. That's who you are. This has been so great and wonderful and revealing to me. That's what I think we need. We need people who are anxiously engaged in this good cause.
Thank you for that. And Dr. Jarvis, I want to ask because you've written about it in your book, and you provide a very long view on the development of this movement, but also the development of the industry and that kind of thing. And so, since we've had these incredible peaks and valleys over the last, say, 5-6 years, and the question is, we've had highs and we've had lows, but if you zoom out and you look at the multi-decade history of the Medicare for All movement in the United States, I'm sure that you see many peaks and valleys in there as well. So can you help us navigate this a little bit? I want to understand, how has this movement changed over those years, and what can we expect kind of in these moments of peaks and valleys?
So 30 years ago was what a lot of people refer to as the Harris-Wofford moment in American politics, where Senator Wofford came out of nowhere and won a special election for the U.S. Senate based on his articulating the health insecurity and suffering that we've just agreed and talked about. He came from nowhere, 40 points down in a race that was very short, and won by 10 points because he kept saying, if you're charged with a crime and you need an attorney, then we have a right to that. But if you're sick, you should have a right to see a doctor. He just said that basically over and over again, and that's what drove him into the US Senate. Now, the next year, Bill Clinton ran on that discovery that there's a lot of health insecurity and a lot of feeling among the American people, and he won. Of course, he didn't intend to do anything about it, which we unfortunately discovered after the fact, and he blew that moment. But what's really regenerating to me in terms of how transformative that moment was is every single new president ever since then has had to run, at least initially, on some aspect of healthcare because it's known now. That's what the American people are hungry for and starving for. That's the important thing to remember. It's terrible that the suffering is happening, but it's driving more and more and more of us to actually be open to saying, we want change. We want it. We want people who aren't going to just sell out after they tell us what we want to hear. We want real change. That's what I see happening. Every single one of those presidential elections proves that to me, and I think we need to do another Harris Wofford moment somewhere in this country, and it'll scare the living daylights out of the people in Congress when someone who shouldn't have been elected got there because they said what everybody needs and what everybody knows. They'll immediately start melting into the background. That's the perspective I take with me every day.
Thank you. And that's perfect because I wanted to then move on and ask Rebecca, and go ahead and start us off, but this also applies to Jason. Because you are both running for office, you've made Medicare for All an important part of your candidacies. And so I'm interested in your experience with the sort of role that this issue plays in the campaigns that you've run, the way that it's received publicly, and sort of what advice you would have in the electoral space around, running as a Medicare for All candidate and taking on this issue. And go ahead and start with an introduction, by the way.
My name is Rebecca Parson, and I'm running for Congress in Washington's 6th Congressional District. Medicare for All is one of the top issues in my campaign because we have, for example, just with COVID, a third of the COVID deaths were due to lack of health care. 67,000 Americans die every year because they don't have health care. In my district, it has some of the highest opioid abuse, addiction, and overdose rates in the entire state, and people literally die waiting in line for drug and alcohol treatment that they want and need. And so it's a big issue for my campaign, and electorally I've found it's a kind of a litmus test. So something unfortunately that candidates have to do is call around and cold call people and ask for money. That's how we have to raise money for the campaigns. And I have some great conversations when I'm speaking with people, and for a lot of them, it's like I ask, what are your top issues? And they said, Medicare for All. If you don't support Medicare for All and the Green New Deal, that's my litmus test, those two. And so it's become a litmus test, I think, with, for good reason. I really think that all candidates should support Medicare for All. And I think in terms electorally, it's helpful to talk about it in terms of what it would do for somebody in their life. So if you're sick, you'll get to go to the doctor. If you're diabetic, you'll be able to get insulin. You'll be able to choose what doctor you go to. And there will be nobody getting between you and your doctor. There won't be any third-party, impartial, office at the health insurance company whose job is to figure out how to deny you money so that they can, or deny you care so they can make money. There'll be nothing between you and your doctor, and you will be able to choose. Every doctor will be in network. You won't have to worry every time, well, if I have to go get a procedure, what if a different doctor sees me because the one I was supposed to see is out sick, and then they're out of network, and I have to pay, really get into those things in people's lives that they can relate to, so it's not just a slogan. And I think also, electoral pursuits is just one of the ways to achieve and keep pursuing healthcare for all. And I think back to one of your other questions, what do activists need? I think one of the top things I see is just to stop disparaging other methods just because it's not the one you are doing. And so I'm pursuing, an electoral campaign, but I think that, what Whole Washington is doing is very important and necessary. And why not pursue multiple paths to the same goal? Whichever one gets there first. Oh no, we all have healthcare now, how terrible. And so just to kind of, if you don't think somebody else is doing the right thing, calling them out on Twitter is probably not going to change their mind anyway. So just go ahead and pursue what you're interested in. For example, I have a background in direct action. I think direct action is really important too. It's not often an overlap with electoral. So I would say that's just really important. There are different ways to achieve it. Let's just pursue them all at once and see who gets there first.
Yeah, 100% agree with what Rebecca just said. There's no reason for there to be conflict between the state-by-state movement, however that proceeds, and the national Medicare for All movement. I mean, every single person who supports Whole Washington also supports national Medicare for All. But I want to follow up with what Rebecca said, in that Medicare for All is a real reckoning for the Democratic Party right now. I don't think that we're going to get any traction with the Republican Party on this healthcare issue anytime soon. But with the Democratic Party, I just say, following 2016, I was elected to the State Central Committee for my county here in Washington. I spent 4 years. And during those 4 years, we passed a resolution that was unanimous in support of Medicare for All. We passed a resolution that was unanimous in support of Whole Washington. And these are, progressives like myself, and more moderates on the state committee. Everybody said, yeah, healthcare is an issue. And yet we have, of the 7 Democrats in Washington State, and I say this very often, we have 5 of them who refuse to support any kind of single payer. The guy I'm running against has flat out said he will not support a single payer system. And I spoke at the Seattle Medicare for All March, and I'm very open about this, that our for-profit healthcare system is a murderous system. It literally lets people suffer and die for profit. So we have a lot of Democrats who are, and this is not even a controversial statement, they are okay with people dying for profit, and we have to change that. We have to change the public's mind about what it is to be a good Democrat. I mean, we're relying on the Democratic Party right now to be the people in Congress who are going to pass Medicare for All. We have to get that public pressure behind them to get better Democrats in office, and that's exactly what Rebecca and I are running for. We are running to be better Democrats in office. So electorally, when we talk about multiple strategies, we're not going to get it passed unless we have the votes in Congress to get it passed. So work on the outside. I'm a board member of Whole Washington, and I think our state-based movement is extremely important. But work on the inside so we can change those votes to actually get bills passed.
Yeah, and so the next thought that I have here is, especially for people here who would consider themselves working on the outside, what sort of actions, mobilization, messaging can we use in order to create that kind of public pressure and to change the minds of people, to reach people who hadn't otherwise thought of it? Did anyone want to take that one?
I'm Lisa Theobald. I am an activist. I come at my activism through being a finance officer in healthcare for private healthcare providers prior to the ACA and through its 7 years of implementation. And it drove me into activism, and I am no longer professionally working in the workforce right now. I spend my time with my son because of COVID and the virtual schooling that was a disaster. So I'm one of the millions of women who had to leave the workforce because of that kind of thing. And I can tell you, I came at healthcare from my experience in employment, operationalizing policy around it. And I was really concerned about costs because that's what a finance officer does, along with compliance and implementation of policy and training and everything else you have to do to juggle it. And I watched a department, my billing department, go from costing the company about 4% roughly, give or take, depending on the year, to costing like 30% to get claims billed and to get them to pay. Not only in a singular non-profit hospice here out in Kitsap County for a couple of years, and I watched that system, that monster hospital system, eat up that non-profit. It was basically handed over. And then I moved to Pennsylvania, and because the job market for high finance people in Seattle at the time was terrible, and I decided to go back home. And I got a job working in, again, a private provider, this time doing hospice, home health, home aid care, adult care. They were moving into potentially doing home nursing. And I had to get credentialed because we're now 3-4 years into the ACA. I had to get the company credentialed with like 13 providers that had moved into the area, because all of the patients that we had in a 60-mile radius were working for employers who, you know, had contracted with the insurance companies, and it was all based on what they could afford as a company to provide to their employees. And I knew this because I had to do it too. Every year I'm looking at, one year it's 14%, one year it's 25%. My husband works in, he's a controller, different industry, but he's a controller. He came home and he said, we're looking at a 25% increase in our healthcare costs. And when you're on that side of it, when you have to, unless you're really inventory heavy as an industry, your largest expense by far is your payroll, with benefits included. But then when you start breaking that up, your benefits is a huge, huge line item expense on your P&L, right? And when somebody's going to blow that up by 20%, you've got to cut somewhere, okay? And often you end up cutting employees, or you do things like you slack on training, or things that make healthcare quality, right? Or whatever your industry mission is. Not to mention the fact that I ran our operation in hospice, that we did not pass on claims that failed from a billing standpoint to the beneficiaries and their families. What I did with my staff was make darn sure that they were trained as best they could, and we billed those claims all the way through to the end. Now in Pennsylvania, and it's not like this in every state, you cannot pass on family debt to kin or a spouse unless they sign on as a guarantor, right? So I was lucky in that sense, but every once in a while I'd get, my boss come over and say, let's just sell these to a collection agency. I'm like, well, they can't go after it in this state, you can't do. She's like, I don't care, sell them anyway. I got radicalized working in corporate America, balancing the books and trying to keep my mission when I got into healthcare was to no longer be a banker and making money off of other people's money, okay? I had to go find my parachute. There was a book called Find Your Parachute. Where do you want to go? And I went into healthcare. And when I finally got out of healthcare, I was like, how is this happening? What are we doing to people? Because it boils down to this. As a society, when we devalue human life, we've lost the thread. And that's where we are. So as activists, we've got to get on the ground. Not in the 11th hour when you got to get that vote out for your congressman. Now, this initiative is on hold. I think that's great because we get on the ground and we talk about it. So when you bring that back, this is not going to be such an uphill climb because people are already going to know.
I've been thinking about that, and I'd like to see escalation. Still within legal boundaries. But I want to see escalation. I want to see our leaders uncomfortable in public spaces. I want to make it hard for them to look their neighbors in the eyes because their neighbors are tired of us hanging out in front of their house. Right? The and I work both inside and outside strategy, so I don't begrudge one over the other. But I am tired of arguing with people who are hypothetically on my side, that we're fighting for the same thing, but they have enough comfort to avoid the desperation that many anxious activists exhibit.
Yes.
I think also too, I totally agree with your point in escalation. The problem is people are worried about consequence. That's the problem. And people would need to realize that activism, by being calling yourself an activist, you're already, for the lack of a better word, a target.
Yeah.
Because you're going against the system, and you have to be okay with that. You have to tell yourself that. If you don't tell yourself that, you can't be an activist.
And forget, I've already lost everything except for my child, so I am here for it. I'm
Right.
gonna die,
Right,
so
right.
I just have to preserve my child's life.
Right, exactly. So if you're not willing to be arrested, if you're not willing to get in trouble, and people say, when you say stuff like that, it was like, what are you talking about? Like, anytime as an activist, right, I've done die-ins, I've done protests in front of people's offices, all of that, police can come at any time and arrest you for doing a die-in. You can be arrested for protesting a politician's office.
Yeah.
That can actually happen. I've been moved from a hospital. I got law enforcement telling me to move. So these things can happen. So you have to tell yourself and people you're protesting, no, we're gonna do this because we believe in this.
Yeah.
So if you're not willing to go there, you're not gonna move the needle.
Yeah.
So all of us as activists, we have to take a stand and be comfortable with making them uncomfortable.
Yeah.
So if you're not comfortable making them uncomfortable, you can't do the job. That's really what it comes down to. So the escalation point is 100% on point. We have to get to a point where we say, we're gonna die anyway. Medicare for all is something we're fighting for. You can't afford it, personally, right? But the country can afford it. This is what we're willing to do.
Yeah.
How do we build that comfort? Like, how do we take people who support the issue, who even want to take action, but then when they have to face the might of the insurance industry, right, or their local police or whoever it is, they hesitate and they can't quite do it. How do we build ourselves up and give ourselves the comfort with creating discomfort that you say?
It's gonna take training. I think that we need to educate ourselves. We also need to put ourselves in a comfortable space. So for example, if you are going out to do a protest, I need to know that I can protest with you, I can protest with you all over there as well, and say I'm feeling a comfortable space. And there are procedures, there are ways. I've actually went to, outside of the healthcare sphere, I've actually gone to 3 trainings to how to engage with law enforcement, what actually happens when you actually go to a protest, certain protocols, certain things you have to do. I've actually did jail supports before. If someone gets arrested, taking people's information, holding their documentation, going through the whole process. There's a whole process of procedures that I have not seen yet in the healthcare activism yet, but I've seen that when it comes to Black Lives Matter. I've seen that when it deals with immigrant rights. So there needs to be some crossover. So a lot of those folks who actually do arrest action, most often than not, they're trained in that. So if you talk to anyone who's in the Black Lives Matter movement, if you talk to anyone who does anything with immigrant rights, they're battle tested. They already know, they're already thinking about that. With healthcare justice, no one barely ever talks about that. So we need to actually start aligning with a lot of that because the escalation needs to happen. And the reason why we need to do that because we need to get out in the street. We need to get that street heat, and we need to push towards making those folks uncomfortable because we do need to go to a politician's office. We do need to even go to their house. I know a lot of people that makes them uncomfortable to say that, to show up to a politician's home, but people are dying. And if we can't reach you at your office, I'm coming to your house now. I'm making you uncomfortable because my community is uncomfortable. So that needs to happen.
So I want. My name's Mariana. I'm a member of the board of Whole Washington, and I'm a nurse. And one point that I want to say is we need to grow. Like, all of us in this room have been fighting as hard as we can possibly fight for as long as we have known that we needed to fight. Right? We need more.
Yeah.
We need. But the problem is, for my entire life and for all of our entire lifetimes, we've been told, no, you don't deserve health care. No, you don't deserve that procedure. No, sorry, you're bankrupt. Too bad. You should have worked harder. The general population of the United States is so pushed down and so downtrodden that they don't even know that they deserve to have this, that it could be a possibility. I was there. I always remember the Mariana that I was in 2015, 2014. I didn't know that we could, I mean, it never even occurred to me that I should have had health care in my 20s and I would still have all of my teeth. I didn't know that. And there's so many millions and millions of Americans that need us to come to them and say, you have the power. We have the power. We can have this. Like, look at this thing that we could have. We could cover everybody for all the things that we all need. And we don't have to die. We don't have to go bankrupt. My dad didn't have to lose every dime he ever worked for in his life because he got cancer and then die with a broken truck in his yard. So people think they deserve that. People think that if they didn't individually work hard enough or have the right connections or know the right people, that they deserve to just die. And they don't deserve health care. So that's where we have to start. We have to get people on the ground, people, regular ass people in our neighborhoods, everybody's neighborhood, and talk to them and say, you deserve to live a dignified life from now until the end of it. You deserve that. And if we don't do that, like if we in this room and anybody who's out there making the case for Medicare for all doesn't reach out to those people, then we're going to keep spinning on this hamster wheel for the rest of our lives, as we have been for all of our lives to this point. So my plea is to make the conversation. Talk to the people that you know. The hard conversations. My brother voted for Trump, or my aunt is this, or whatever. I don't care. Have a crucial conversation with them. Tell them you deserve health care. You deserve to live. And your children deserve to live the rest of their lives, with good health. And that's the only way we're going to change it. We can argue amongst ourselves of what strategy is the right strategy. But if we don't grow our army of people who want health care, who know that they deserve it, then it'll just continue like this until perpetuity, because they have all the money and all the power.
Can I break in?
I was going to say, I'm sorry.
You go ahead.
I'm sorry to interrupt too. I'm sorry, what was your name again?
Mariana.
Mariana. I was going to say, as cheesy as that sounds, that's the first step. Talking to our community and talking to our family. I know that sounds weird and everyone kind of says that, but I really believe that. I think it's so crucial to reach out to folks you A, don't talk to normally, and B, people who disagree with you, because again, politics is about pushing people to your side and getting them to come to your position. So I totally believe that 100%. That's how you actually get the allies.
Jason, did you
Yeah,
want to
I just wanted to follow up on what Mariana said. And what we see in the healthcare movement with, not recognizing that you deserve dignity in healthcare is something that we see sort of across the board, and really defines what the progressive movement, I think, is about. Is saying people deserve dignity with housing. They deserve dignity in our immigration system. They deserve dignity with education. You have a right to these things. So I think that's what the sort of the larger progressive movement really is about, is having people really develop an understanding that they deserve human dignity across the board. We live in a society where you are privileged by what is essentially an accident of birth. And if you don't have that privileged accident of birth, you struggle your entire life. And I think there's just an evolution to human society that we are seeking, and I think as healthcare activists we're on the forefront of that. But it's not just healthcare; it's just really across the board with issues.
And like what Sharif said that earlier, the skills that we need to use are available in other siloed issues. We just haven't. The Medicare for All community hasn't brought brought those skills to our own community yet. We haven't ramped up like that. And Sharif casually said, we all have to do this. But I do want to caution, there's a place in the revolution for everyone. So some of us are willing to get arrested. Some of us will be at the next level out. And some of us will be behind computers doing data entry. There's some place for everyone. But we do need to rally the people who are willing to go bigger, to get out here and go bigger with us.
Mm-hmm. Well, so this idea of growth and inclusion has come up a bunch in this panel, and I wanted to ask Laura, because you started this Craftivist movement a good number of years ago now. You started a sort of social media following, and in that time, can you tell me a little bit about the people that have been brought in from that, and your experience kind of trying to reach people through that avenue?
I'll find it. Mariana made me cry, so Mariana's like one of the first people that's, I guess I want to say we face incredible adversity, but Kenny Valentine says he believes in magic, and that at its most whole, I believe that about this movement too. And the reason is because, born out of the aerial views of the Pink Hats, and then hearing, the cry of the National Nurses United in the fall of 2017, I just started thinking we need a peace army for National Improved Medicare for All. So if it's a peace army, we need a beret. And I just knit my first beret and posted it on Facebook in like Bernie 220. And then that was a nurse, on the board of Whole Washington, because I was like, when are we marching for Medicare for All? Let's knit for nurses in the 99%. Well, that was Catherine. And then Catherine came to my house and she said, have you heard about Whole Washington? No, I don't know anybody. I'm not connected up with any activists. I just know that I voted for Bernie, and, I thought I could use my knitting talent towards this movement. It seems really important. So the next step was I go down to a house party for Whole Washington, and who do I meet? But Georgia Davenport and Mariana, and we just looked in each other's eyes and we just went, yeah,
We're doing it.
we're doing
We're
it.
doing this. Yep. We're gonna make it.
And then then we were knitting and crocheting for the Women's March, and this is where I met Courtney and all of the Washington Bernie Crack Coalition. And so, it was like the magic of the movement has brought me, and then, I feel like it's kind of come full circle, because initially I started knitting and then some other crafters joined me, and we were really knitting and crocheting for our local activists with Whole Washington and the Bernie Kratz, whose platform is obviously Medicare for All. So the original intention was crafting for National Improved Medicare for All. But we hung our hat, we found our home. Whole Washington gave us a home for our craftivism, for a way to really get it onto people's heads. And then it linked up with candidates, This is Washington State has really been this is how we don't know anything other than a multi-pronged approach, because we're just all connected with this stuff. And then I want to say, in these recent months, when Sharif Snuggs reached out to say, we're doing a march. We're doing a march in DC, and we want the Red Berets and Whole Washington. You guys are the real deal. And I was really pretty burned out at that time, and also thinking about doing this initiative, and I was like, that's a major, major endeavor, and it sounds really important. So we had quite a few conversations, but the point I want to say is when it really started to hit home that the whole thing had come full circle, and that the aerial views in cities not just across the country, but all over the world of the pink hats. And I thought, wait a minute, you know, this is what Sharif's saying, we're doing a march, and I think they're starting to do one in LA. And he kept asking her, what about Washington State? What about Seattle? It started to come back that, wow, this has kind of come full circle. It started with the idea of national, and it kind of really came back very connected to people and meeting local Medicare for All activists. And now it's back to this, like, maybe this is really important despite the fact that we have an initiative they're going to be ready to launch. And that's when I was like, I can't pull off, so reached out to you, Andre. And then I just look at, I'll say briefly, you know, what's happened today, what's happened within the last 24 hours. We have, in this week, the Board of Whole Washington, us having to make this painful and very difficult decision to suspend the signature gathering campaign and kind of notifying Kenny, this is what's happening and now what are we doing. But just seeing the magic that's already happening today, and, you know, Sharif and Lisa finding people that want berets, and finding, you know, these women that have the clothing shop next door, and they'd love to have our berets in their shop, and they'd love to just put Medicare for All and like the websites on there. There's like the magic and the connectivity is there in our movement. When we're in the best of our movement, and there are going to be times where we're just in that sort of, no, it's not that way, you think this is wrong. But then, you know, when we're in the kind of connectivity and magic of it, it really is meant to be that every single person that I know in this room and that knows me, we're meant to find each other. And we are in this together. And we have just found more people that are in our movement today. And now they know about March for Medicare for All, and now they know about Whole Washington. And on the inside-outside, or the potential escalation, I would still like to say, speaking out to the crafters out there, let's be visible. Get your sign out that says we need Medicare for All, or wholewashington.org, and sit outside of your representative's office or in public view somewhere and get your crochet needles, and let's do like Michelle's doing there, let's be visible in our craft. And we craft for everyone. We try to craft for everyone. We want to craft for candidates of any party that you're running on for healthcare justice. We want to craft for people in organizations that are doing boots on the ground. We want to craft for national. We want to craft for local. This is really about building solidarity, and it's about building a societal fabric. So that's what we're doing. That's what yeah.
And I, I've been waiting for that word to come up. It might have come up earlier, but I want to take a minute now because I think it's kind of where this group has wanted to take this conversation, where we've gotten. And I really like that you talked about that process from national and then being brought in by Whole Washington and then having it come back out again to a national set of marches. And so it's kind of showing how this is built in two directions. And so I kind of just want to open to the floor, and hopefully we don't step on each other's toes too much, but like what is a solidarity-based strategy like to you, and what are ways that we can work that in both directions?
One of the frustrations I'm an electoral enthusiast. It's how I came to the left. I cried with joy when I turned 18 so I could finally vote. So when Bernie came up, I was like, oh, I can actually participate and not feel dirty in electoralism. And so I got involved in various spaces for that. I'm trying to remember where I was going. I want to remember your question better.
Solidarity-based strategy.
So one of the frustrations I've had is the siloed issues. Like I really don't have time to go to a monthly meeting for Medicare for All, for Green New Deal, for right. And so that's kind of why I was into electoral, is because I could have an opinion on every topic. Of course, I found myself hyper-focusing on Medicare for All. amongst a few other things. But the siloed issue, like the solidarity, we need to show that between our siloed issues, and we need to be marching together. All the issues on the same days together, because that's solidarity. Also, every siloed issue, when they talk about, healthcare, who's the most impacted by lack of healthcare, insufficient healthcare, poorly administered healthcare? Oh, people of color, people of economic depression, people with disabilities. Okay, who are the people who are most impacted by environmental problems? Oh, you know what? They're the same crowds. So us white-led, siloed issue organizers need to have solidarity with each other because the solidarity with the people who are most impacted depends on us coming together. So what unifies the siloed issues is the corrupting influence of money in politics, and also who is most impacted by the lack of attention to our siloed issue. So to me, solidarity comes from between organizations, but also when we're out there rallying people on the streets to our cause, that's class solidarity. And that's something I think is very important for everybody who is left of center, left of average Democrat, needs to be talking about and learning about class solidarity. So that's what I'm on.
I don't think it's party affiliation
Me
though.
neither.
Not always.
Well,
right?
To me, it's simply the
That's
rhetoric.
right.
You know, the people who talk about it.
Okay.
Don't underestimate the congealing effect that having health care for every American will have. That will provide a social capital that is that we lack today.
Right.
That lack is at the basis of why we're such a fractured society. It's why there's an appeal for this nationalistic populist. It's because people don't have a dog in this fight. They don't have the social capital. They don't have something that brings us all together. One thing out of all these issues that you've mentioned, which will provide that glue that will bring us all back together as Americans, is healthcare. Because we'll be putting hands on each other.
Right.
We'll actually be loving each other. The power of that will transform our society. That is my view of how we actually move forward. If we elect people who will help us make that transition, they'll be the same people who will try to solve these other problems. They'll be reasonable about it. And you're right, this is bipartisan failure. Both major parties, there's not a dime's worth of difference between them on health care. And therefore, they're not doing anything on anything else either. We can change this with health care. Bring people back. Everybody needs it. Everybody knows they need it.
So, in all of this, and you're making me cry, James. Okay, so here's what I see. I worked the census, you guys that know me know this. The census plan to get into the disenfranchised, non-responsive populace, to get them to fill out their census in the 11th hour, was to go follow around the politicians. Anybody who's working 3 jobs to put food on the table and keep a roof over their head ain't going to a political rally.
I don't even know there is one.
Right.
Yeah.
No shit,
That's
right?
not-
And excuse me, but
Yeah.
damn it, now I'm mad. Okay? So when COVID hit, they sent us all home. I was in charge of a extended field operation process within the census, was to get people on the teams out into the neighborhoods, provide the ability to help them fill out their census, right? And you want to talk about all kinds of constraints around that. I mean, it was almost an impossible task. And I'm talking to them and I'm just like, so let me get this straight. I'm going to be out in crowds at a fair, sitting down with people who have yet to fill out their census. I've got to find them. And where am I going to do this so I've got the right privacy? Like, this didn't work from the get-go. Okay, so let me tell you all one thing that was maybe the silver lining in COVID, we had to rethink. Because nobody was going out. We didn't have a complete count committee made up of businesses and politicians and faith-based community organizations. We were all locked down. And me, being the operations person, right? They're like, I don't know what we're going to do. And I said, I know exactly what we're going to do. We're going to get into the transfer stations. We're going to work with the transit authorities and get on the bus lines. We're going to get to the food lines. Because I had all the data at my fingertips and I knew exactly, I'd been studying it forever, low response, disenfranchised, right? Who are these people? What are they doing? Okay? I know how to penetrate a ground game with the very same demographics of people that are going unanimously to get behind us. And they're the same people that progressives need to get elected. And they're the people that nobody ever talks to. And I got 99.999% of the whole damn county with a team of 20 managers knowing exactly how to go get those people. We did it. We almost had 100% and then they kicked something back. But we got them all. This is going to be the best census count going back in history because we had to get, guess what? The corporations and the politicians out of the way. It's a ground game. I don't need to get arrested, but we need people who are willing to do that. I don't need to do that. If you want to do this, I know exactly. The maps are all out there. Where do you go? What do you do? They're still in food lines, damn it.
Yep.
They've got to go to the grocery stores every day.
Yep.
Everybody's got to go to Walmart once in a while or Lowe's. They're taking the damn public transportation, guys. You talk to the Uber drivers, for Christ's sake. They can be our best friends.
Yeah.
This isn't hard. It's not a secret. We did it in the census. It's going to get you elected. It's going to get you elected. And every other politician that we can find that's on our side. It's not hard. I promise you it's not. We can do this. We know who these people are. They're the same people that are on our side, that have been in the shit forever. We know this.
They just need the hope.
They just need us to go talk to them.
But Dr. Jarvis and Lisa was referring to, they didn't say it, but what we essentially need is a win. But that's what she's really speaking to. This country needs a win. Everyone feels very apathetic. They feel hopeless. There's no hope in this country anymore. So we need a win. So once we get a win, that's going to build that solidarity that you were mentioning. Right? We need a win. We need one chip away at the iceberg or the wall, whatever. We need a win to build that hope. And that's how you get that solidarity back. Nothing in this country, I know one thing about Americans, we have a win, we rally behind a winner. And once we have that one win, whatever, how we get there, that's going to build more solidarity. And that's really what it's going to take, actually.
So Sharif, they're not going to let us win.
Oh, we're going to.
We
We're
we
gonna
have
win.
to we
We're
have to
gonna
be
win.
able to do this work,
We're going to do
whether
work.
we win or not.
We're
We
gonna
need
do-
it. You know what I mean?
we're gonna
Whether
get
we,
there.
I know I want to win, and I want to win. Oh my
Well,
God.
what I mean by win too, I don't mean like getting Medicare for all tomorrow. That's not what I mean by a win.
Yeah.
I'm talking about what Lisa's just referring to, about using the census, contacting your Uber driver, communicating with people in your community. That's
Yeah.
a win for me.
Right,
That may be
that's
small to
it.
We
somebody
gotta
else.
count it as
So-
a win.
That
You
might
gotta
be
go
small-
out there
That might
and
be
get
small to
those
somebody else. But
Let
for
them
me,
know we're
that's
here.
success.
Yeah.
When I have my community involved and engaged, that's a win. That's success to me.
That's a good
Yeah.
message.
And I mentioned this to Laura earlier, that what we're doing today for this event, having the community engaged and speaking to small and local businesses, because we don't have a lot of business owners in this fight, to me, again, that's success. That's a win for us because that's another demographic that wasn't in this fight, and that's what's going to take. We just keep chipping away and away and away, and getting more people in the fold. That's success to me.
And that's something that I learned how to do with the census too. And this is a gift.
Right.
We should get out of here and hit every one of those booths
No, absolutely.
and talk to them. Right?
Absolutely, absolutely.
Because it's not going to the Highmark and the Amtrak station and talking to those employees, which is everybody's like, oh, well, we'll just go talk to Nordstrom people, right? Okay, go, do that.
So I
It's
want
not
to
that.
I want to focus this just a little bit on. We've discussed like okay, you employed many strategies. We need a win. So in just about a year, whole Washington will be running its ballot initiative again, and midterms will be just on the horizon. So that gives us just about a year to figure out how do we take those two very important moments and get that win that we've been discussing that we need. So specifically in that context of that year-long time frame that we have, what should we be doing in that time?
Well, can I? I want to talk about something that we should not be doing, and it has come up with the national marches that Sharif organized, and it's come up with whole Washington. And what we should not be doing is tearing each other down for trying different strategies. And I'll tell you, for somebody who has put years into whole Washington now, to have other people, and as I said at the beginning of this, everybody who is a part of whole Washington wants a national federal system. But if we're not going to get that, and I want to be very real about what the makeup of our Congress is right now, if we are not going to get that, then we should do our damnedest to try and get it for a small segment of the national population, a state-based population, and show that it can work. And so to have people who want that same goal of national Medicare for all, but to have them try and knock us down for trying a different avenue, I just want to appeal to people to stop that. And it's the same thing with the National Medicare for All marches. I was advised by some people. I was so excited when I heard. I talked to Laura. I said, "Get me in." And Andre, I told you, I want to speak at that event. I got some shit to say. And I had some people who were advising me, this isn't going to come off well. This is, it's going to, if it fails, you're going to be saddled with having participated in the thing that was a failing thing. And I had to push back on that. I have been an activist my entire life. I've been an activist since I was 19 years old, and I'm 50 now. And there wasn't anything that was going to keep me away, other than being denied an opportunity to speak. But from speaking at those rallies, because those are the things that we need to do to keep putting the issues front and center. And so it doesn't reach as big an audience that makes it, some kind of like the national media is going to do everything they can to avoid paying attention to us. But we are speaking to our communities. We are not speaking to national media. We are trying to reach our communities. So for when people start to put things together that is activism, that is something, it is going to reach some people, stop stepping on it and saying it's not worth anything. It's all worth something. The national what the national marches grew into was nothing, in my opinion, nothing short of amazing.
Yeah.
The fact that we had people in what was it, over 50?
56, yeah.
56 cities across this country who said this is an important enough issue for us to get out of our houses and go be in solidarity with our community activists. That was something. So
Huge.
My appeal to people who want national Medicare for all is to, one, look at the reality, start electing people who are going to vote for it, because you're not going to get it unless you get votes for it. But all of those other avenues to that kind of activism, we talked about solidarity, stop saying there's only one way to do this. There's a lot of ways to do this, and we need to be working on all of them.
Thank you.
Agreed.
I had what do we need for whole Washington for this year? We need, I was really hoping Nina Turner would win, because then she'd be a really good example of how the progressive left of the nation actually has to rally around one congressional district to get a win practically. Like we saw this when AOC was running. Brand new Congress and Justice Democrats were supporting a lot of candidates, and at the end on paper they were, but having worked with a number of candidates during that year, I saw these organizations pull back a little bit just so that they could get AOC over the hump. And then, so I was hoping we could see the nation rally and get Nina Turner over the hump. And then I was going to suggest that whole Washington be the next one.
I was going to say a suggestion for whole Washington, what they should do the next year. So, driver co-op is a worker co-op that's in New York City. It's like Uber or Lyft, but it's driver owned. They was actually a part of the March for Medicare for All in New York. And then we also had Copperhead Farms. They grow their own marijuana, and they actually gave out CBD at the New York March. And so why do I bring this up? You have to get more businesses engaged into this fight. So I recommend Whole Washington get small businesses say I endorse Whole Washington on their store. If you can get taxi drivers, you can get nurses, nannies, whoever it is, and say I endorse Whole Washington.
The
People will
beach
be
shop.
asking questions like, hey, what's Whole Washington? Well, QR code. Well, this, well that, and I think that will do it. Like the ballot initiative is great, but I say promotion. Get those
Get 'em
those
ready.
stickers on the storefront first, then get the signature second. That's what I would do.
Yeah, and you
Yeah,
got,
we definitely need people to know what the hell we're talking about,
Right.
and who we are.
Right.
Because you go out to a festival or something like I was doing to gather signatures, people have no idea. Like
Right.
they don't even have a clue what healthcare for all means.
Right, Brandon.
You know, and then whole Washington is like they've never heard of it. So
Right.
we've got to get it out there in front of everybody,
Right.
so that we can have the conversation. And, you know,
To the people who are disappointed by the decision by Whole Washington to stop signature gathering, let me give a personal story. March 2020, I was running for lieutenant governor in Utah. And of course, the pandemic starts having its impact. My colleague who was running for governor and I were collecting signatures at a good pace, on track to get enough to get on the ballot, and then we would stop. Now, we made that choice on our own. We weren't told we had to stop. We realized that that was the right thing to do. Whole Washington has done the right thing. And when you do the right thing, you will be blessed for it. So I have been blessed by that decision, even though obviously I didn't get on the ballot and I didn't get elected. But because I'm not serving as a lieutenant governor, I get to be here today. I have met every one of you. I have actually gotten the thing that I care about most, which is reforming our healthcare system. I've actually learned a lot and found new colleagues and new energy and new opportunities. That is what's going to happen for Whole Washington. So to those people who are disappointed, let me say, be patient, wait for the good things to happen, because when you do the right thing, they will come. Okay? That's my advice to the people in Whole Washington.
I really appreciate that, because I don't know how much time we have left, but I wanted to make sure that I take a moment to ask the panel, in my opinion, the sort of doomerism that can set in at the moments of setbacks and losses, and I think so much of what we're seeing is kind of coming in this wake of, we had this national figure, Bernie Sanders, who brought many people together, and then after that loss, we see this sort of vacuum of focus, and the attention then gets turned onto each other, and it can often have conflict, and people, the last thing they remember is that Bernie lost and then that Nina Turner lost, right? So how do we not let that doom and gloom set in? How do we lift not only our own spirits, but the spirits of everyone in this country, so that they come along with us and get this over the finish line?
can I speak from a mental health perspective? That's where I work as a nurse, is in mental health. So we don't not feel that. We feel it. We let ourselves feel that doom, that disappointment, that
here we
you
go again.
feel it. You let it in, you cry about it, you do what you gotta do, and then you move through it. Because if you're going through hell, just keep going, right? You can't pretend like it didn't happen. You can't say, oh, just put it, and then just put it away, put it in your backpack, because then it's just gonna come back and beat you over the head again. So you go through it. You take the day or 2 days or however long you need to mourn that loss, and then you get back up and you go at it again. Yeah?
I think too that we have to remember that Twitter is one of those places, or any platform can be one of those places where there's a lot of power in ignoring the damn trolls.
Yeah.
Yeah, I'm hardly on there.
You know, like, well, we have a lot of communication that happens. I would not have let any of you people in this room without it.
That's the conundrum, is that it's both, it can be incredibly divisive and destructive, but it's also been, I would argue, the vehicle through which the March for Medicare for All ever came to be. How we let so many people know. It's how I met Lisa. It's really how Dr. Jarvis and I and whole lot, you know, we've all been connected up quite strongly through that. Having said that, I kind of feel like, all right, we've kind of got the message out. We're built our community. It might be time to be doing a little bit more of this healthcare for Hilltop and a less time with people who want to continue to argue instead of just finding the best action that they see fit in that. You know, that's all I think that we're asking is, go do an action. If you have an action that we can join or help amplify, please let us know what that is and we'll help. Otherwise, if it's a different thing than what we're doing over here, what we ask is, go do your thing. If it's towards Medicare for All, we're all pushing together. We're all going in this direction. We are all moving this way. So let's not stop and, you know, it's a waste of time. So we have to, especially, but it's like, let's not get too caught up in that. At the same time, sometimes I feel like it's necessary because we don't want a particular narrative that does tear away at the fabric to take hold. So where is that line between taking that in tow and saying, listen, it's really important for us to let you know this is why we perceive it to be damaging to, what did you say earlier, Courtney? Divide the army?
Yeah.
I mean, it's pretty simple. It's like we can't be divided on this. We don't have to all do the same actions or do them in the same way, but we shouldn't spend time pouring water on the efforts that others are doing.
Social media is a very powerful tool, but it is a tool.
Yeah.
The real movement happens right now, where we
Yeah.
are in this room, when we go to door, when you go to a festival, when you talk to your neighbor. That's where it really happens. Like the magic that we want, that we have, that when I'm working with a nurse I haven't worked with before, and the subject comes up of healthcare insurance or whatever, I take the opportunity. Can we talk about universal healthcare? And and she's like, yeah, most of the time they all have petitions out there somewhere that they're gathering signatures on still, and they don't know, and that we're not gathering them anymore. But that is where the magic is like just the next person. That's the win that we all need, right, Sharif? That next person that's in the movement.
Yeah.
The win I'm looking for is the first Republican congressman to endorse the state-based universal health care.
Oh, dude,
That would
And
be sweet.
I will help anyone in the audience who wants to meet personally with a Republican member of Congress. I will help them prepare for that meeting.
Absolutely.
I will go with them to that meeting if that's what they want me to do. That's my win.
Awesome.
Well, I think that's all.
Well, we've got Sharif's
You wanna
letter.
read his
But
Yeah,
also,
exactly.
I forgot to say, hi, I'm Courtney Love, and I am on the board of Whole Washington. I'm a DSA member, a Democratic Party PCO, and a former participant in our revolution, among a few other things, and I'm here for the cause.
And I think I would just want to advocate for my hopeful future member of Congress, just to ask if there's anything else that you'd like to add, Rebecca.
This has been a great discussion. I'd like to reemphasize what Courtney said about class solidarity. I think if we remember our class solidarity, then the arguments won't be as important that we're having with each other. You know, the real grifters are not people trying to get Medicare for all. They're the health insurance executives who are profiting off our misery and death.
Yep.
So I think remembering that class elder, we are the class of people who bodies and life and death are just a source of profit to these bloodsuckers. And we have that in common as a class of people.
Yes.
And to remember that, that would be the only thing I would add.
Thank you.
Thank you. And so I think with that, we've got Sharif's statement. Very excited to hear it.
Well, it's definitely not really so much a statement as a speech that I thought I was going to be speaking. And this is the first speech I've ever written too, to be honest with you. It's called To Be in Service. What does this really mean? It is a contract with the community that you will provide a service in ethics, in law, and a service to build a better community for all. That is what the role of a public servant is supposed to be about. I traveled here from New York City to Hilltop to show solidarity for a national, improved, and expanded single-payer healthcare system that is free at the point of service. I want to say that again, that is free at the point of service. When was the last time our public servants were in service to our community? So many of our countrymen and women are going to die this year because we don't have Medicare for all. Our public servants should all work in hospitality because they will learn what Master Sommelier Bobby Stuckey calls being a hospitalian. I've been a waiter for over 10 years, and like a lot of people, confuse service with hospitality. I know some of you I'm going to lose, and you're going to ask me, why should you talking about hospitality? Just wait, it all makes sense. To be in service is what you do for someone. To be in hospitality or to be hospitable is what you make someone feel. How does your congressperson make you feel? How does your senator make you feel? How does your president make you feel? I'm going to lose some of you because when you go to a restaurant and your food and your beverage is late, you walk out of that restaurant. You ask for a free meal. You ask for a free drink. Some of you may even write a bad Yelp review. Why do you tolerate late health care? Why do you tolerate no health care at all? More importantly, why do you tolerate a loved one dying this year? We need our public servants to be hospitalians. We need Medicare for all now.
Also, I want to thank you, Andre. This is officially the third time that you have come through when I've reached out with this request. The first time was Power to Heal, where Justin Jackson and Dr. Dooley joined us. And I mean, and then I just knew based on that I could also reach out to you with the request to lead the Seattle March for Medicare for All. And you did such a fantastic job. It was really important that it didn't become the whole Washington March for Medicare for All, but also that, damn it, we're running an initiative and that whole Washington got a strong presence. You and the team pulled that off just like beautifully. So this is why I was like, Andre can lead our panel discussion. So it might be that this is 3 and there will be more, but I just thank you. I mean, you're really incredible.
Yeah, you've done a killer job.
Thank you, Laura.
You're welcome.
And, yeah, so thank you everyone for tuning in and watching. And again, one more time, thank you to each and every panelist for being here. I think this is the exact kind of conversation that we need to be having in so many ways, on so many issues all over the country. So anyone who is inspired by what they just saw, reach out, have a conversation, record it, throw it on YouTube, get in touch. There's a million ways to be a part of the movement.
And we mean that. Reach out.
Pick up your crochet hook, just like we've got Michelle crafting here, you know? There's lots of quiet crafters out there that don't want to be...
That's my Michelle?
What's
That's
that?
your Michelle.
That's your
That's
Michelle.
my Michelle.
Yes,
Yeah,
your
she
Michelle. Bring it in.
Thank you again.
All right, you're welcome. Thank you for wearing that hat. It looks great on
Thank
you.
you.
Here.
Thank you.
Not so good on a little pinhead.
It started here, it went to New York, it's back here again.